Hello everyone, and welcome back to my channel. That has gained more attention recently. So, let's dive in. Monkeypox is a rare viral disease that can spread from animals to humans. It is similar to human smallpox but less severe. The virus is usually transmitted to humans through close contact with infected animals, such as monkeys, rodents, and other wildlife. In rare cases, human-to-human transmission can occur through respiratory droplets or contact with infected body fluids. Preventive measures to reduce the risk of contracting monkeypox include avoiding contact with wild animals, washing hands regularly, and practicing good hygiene. There is no specific treatment for monkeypox, but supportive care can help manage symptoms and prevent complications. Causes of monkeypox. Monkeypox is caused by the monkeypox virus, which is part of the same family as the smallpox virus. It was first discovered in laboratory monkeys in 1958, but it primarily occurs in Central and West Africa. The virus can be transmitted to humans through direct contact with infected animals, such as rodents or primates, as well as through human-to-human transmission via respiratory droplets, bodily fluids, or contact with contaminated materials. The long-term effects of monkeypox can vary depending on the severity of the illness and the individual's overall health. In most cases, people who recover from monkeypox do not experience any long-term complications. However, in some cases, there may be lingering effects or complications that can occur, such as scarring from the rash, post-inflammatory hyperpigmentation, or lymphadenopathy, swollen lymph nodes. Rarely, severe cases of monkeypox can lead to complications such as secondary bacterial infections, pneumonia, or encephalitis, inflammation of the brain. These complications can have long-term effects on the affected individual's health and may require ongoing medical treatment. Overall, the long-term effects of monkeypox are relatively rare, and most people recover fully without any lasting problems. However, it is important to seek medical attention if you suspect you have been infected with monkeypox to receive proper care and monitoring. What is origin of monkeypox virus and their structure and how it works after enter into human body? Monkeypox virus is believed to have originated in Africa, where it circulates among various animal species, including monkeys, rodents, and other wildlife. The virus is a member of the Orthopoxvirus genus, which also includes variola virus, the virus that causes smallpox, and vaccinia virus. The structure of the monkeypox virus is similar to that of other poxviruses, with a complex structure consisting of an outer envelope and a core containing the viral genome. The viral genome is composed of double-stranded DNA and encodes various proteins that are essential for virus replication and infection. When the monkeypox virus enters the human body, it typically occurs through direct contact with infected animals, their body fluids, or contaminated materials. The virus can enter through breaks in the skin or mucous membranes, such as the eyes, nose, or mouth. Once inside the body, the virus infects and replicates within host cells, particularly skin cells, causing the characteristic symptoms of monkeypox. The virus initially replicates in the respiratory tract before spreading to other organs, including the skin, lymph nodes, and internal organs. Symptoms typically appear within 5 to 14 days after exposure and may include fever, headache, muscle aches, and a rash that progresses from macules to papules, vesicles, and pustules. The immune system responds to the virus by mounting an immune response, which helps control the infection and limit the spread of the virus. In most cases, the body is able to clear the virus within a few weeks, leading to recovery. However, severe cases of monkeypox can occur, especially in immunocompromised individuals, leading to complications such as pneumonia, encephalitis, and death. Symptoms of monkeypox. Symptoms usually begin 5 to 21 days after exposure and can include fever, chills, headache, muscle aches, fatigue, swollen lymph nodes, rash that usually starts on the face and then spreads to other parts of the body, The rash goes through several stages, including macules, papules, vesicles, pustules, and eventually scabs. Treatment options. Although there is currently no specific treatment for monkeypox, supportive care can help manage symptoms. Some approaches include pain relief with over-the-counter medications, hydration and rest. Antiviral medications, such as tecovirimat, may be used in severe cases or for high-risk populations. Consulting with a healthcare professional is crucial for anyone experiencing symptoms or concerning exposures. Prevention tips. To reduce the risk of contracting monkeypox, consider these preventive measures. 1. Avoid close contact with people who are infected or symptomatic. 2. Practice good hygiene by washing your hands frequently with soap and water or using hand sanitizer. 3. Wear protective clothing if you are in areas where monkeypox is endemic, especially in settings involving animals. 4. Avoid contact with animals that could be infected, particularly in regions where monkeypox is reported. 5. Stay informed about outbreaks and follow public health guidelines. Are there any vaccines available for monkeypox prevention? Yes, there is a vaccine available for prevention of monkeypox. The smallpox vaccine, known as the vaccinia virus vaccine, has been shown to provide some level of protection against monkeypox. This vaccine is related to the virus that causes monkeypox, and vaccination with the smallpox vaccine can help reduce the risk of contracting monkeypox or lessen the severity of the illness in case of exposure. The smallpox vaccine is not routinely given to the general public because smallpox has been eradicated globally since 1980. However, the vaccine is recommended for individuals at higher risk of exposure to monkeypox, such as healthcare workers, laboratory workers, and individuals living in or traveling to areas where monkeypox is endemic. It is important to consult with a healthcare provider or travel medicine specialist if you are considering vaccination against monkeypox to determine if the vaccine is appropriate for you, given your specific circumstances and risk factors. Are there any other preventive measures I can take to reduce the risk of contracting monkeypox? Yes, there are several preventive measures you can take to reduce the risk of contracting monkeypox. 1. Avoid contact with wild animals. Monkeypox is primarily transmitted to humans through direct contact with infected animals, such as monkeys, rodents, and squirrels. Avoid handling or interacting with wild animals, especially in areas where monkeypox is known to occur. 2. Practice good hygiene. Wash your hands frequently with soap and water, especially after handling animals or coming into contact with their feces or urine. Use hand sanitizer if soap and water are not available. 3. Avoid consuming bush meat. In regions where monkeypox is endemic, avoid consuming bush meat, meat from wild animals, as it may be a potential source of infection. 4th, practice safe food handling. Ensure that meat is thoroughly cooked before consumption, and avoid consuming raw or undercooked meat from wild animals. 5. Use personal protective equipment. If you are a healthcare worker or handle animals in a laboratory setting, use appropriate personal protective equipment, such as gloves, masks, and gowns, to reduce the risk of exposure to the virus. 6. Stay informed. Stay up to date on the latest information about monkeypox outbreaks in your region or areas you plan to visit. Follow recommendations from health authorities and take necessary precautions to protect yourself. 7. What types of immune responses are triggered by the body to fight off a monkeypox virus infection? When the body is infected with the monkeypox virus, several components of the immune system are activated to fight off the infection. The immune response can be divided into two main categories: the innate immune response and the adaptive immune response. 1. Innate immune response. The innate immune response is the body's first line of defense against pathogens, including viruses like the monkeypox virus. This response is nonspecific and acts quickly to detect and eliminate the virus. Key components of the innate immune response include macrophages and dendritic cells. these cells ingest and destroy the virus and present viral antigens to activate the adaptive immune response. Natural killer, NK, cells. NK cells play a role in killing virus-infected cells to prevent the spread of the infection. Cytokines, these signaling molecules help regulate the immune response and activate other immune cells to combat the virus. 2. Adaptive immune response. The adaptive immune response is more specific and involves the activation of B cells and T cells that are capable of recognizing and targeting the monkeypox virus. Key components of the adaptive immune response include B cells. B cells produce antibodies that can bind to and neutralize the monkeypox virus, preventing its spread and promoting its clearance from the body. T cells. T cells, including cytotoxic T cells and helper T cells, help coordinate the immune response. Cytotoxic T cells can directly kill infected cells, while helper T cells assist in activating other immune cells. Together, the innate and adaptive immune responses work to control and eliminate the monkeypox virus from the body. A robust and coordinated immune response is essential for clearing the virus and preventing severe illness. In some cases, however, the immune response may become dysregulated, leading to excessive inflammation and tissue damage, especially in severe cases of monkeypox. Is there any correlation between the strength of someone's immune system and their ability to fight off monkeypox? Yes, there is a correlation between the strength of a person's immune system and their ability to fight off monkeypox. A robust and properly functioning immune system plays a crucial role in combating viral infections, including monkeypox. Individuals with a healthy and well-functioning immune system are generally better equipped to mount an effective immune response against the virus, leading to quicker clearance of the infection and a faster recovery. Specific factors that can influence the strength and effectiveness of the immune response against monkeypox include 1. Prior immunity. Individuals who have been previously vaccinated against smallpox or monkeypox, using the vaccinia virus vaccine, may have some level of pre-existing immunity against monkeypox. This can help reduce the severity of the infection and improve the outcome. 2. Age and overall health. Infants, young children, elderly individuals, and those with underlying health conditions or compromised immune systems may be at higher risk of severe monkeypox and complications due to a weakened immune response. 3. Nutritional status. Adequate nutrition is essential for maintaining a healthy immune system. Malnutrition or deficiencies in certain vitamins and minerals can compromise immune function and increase susceptibility to infections. 4. Genetics. Genetic factors can also influence the strength and effectiveness of the immune response. Some individuals may have genetic variations that affect how their immune system responds to viral infections. While a strong immune system is important for fighting off monkeypox, it is also essential to seek medical attention if you suspect you have been infected with the virus. Healthcare providers can provide appropriate care and treatment to support the immune response and help manage the infection effectively. I have a question about the transmission of monkeypox. Can you provide more details? Certainly. Monkeypox is primarily transmitted to humans through direct contact with infected animals, such as monkeys, rodents, squirrels, and other wildlife. The virus can be spread through several routes of transmission, including 1. Direct contact with infected animals. Handling or coming into contact with infected animals, their body fluids, or contaminated materials can transmit the monkeypox virus to humans. This includes activities such as hunting, preparing bushmeat, or caring for sick animals. 2. Respiratory droplets. In rare cases, the monkeypox virus can also be transmitted through respiratory droplets when an infected person coughs or sneezes. This form of transmission is more common in human-to-human spread of the virus. 3. Contact with contaminated objects. Monkeypox virus can survive on surfaces and objects for a period of time. Touching contaminated objects or surfaces and then touching the eyes, nose, or mouth can lead to infection. 4. Human-to-human transmission. While less common, human-to-human transmission of monkeypox can occur through close contact with an infected person's skin lesions, respiratory secretions, or body fluids. This form of transmission is more likely in settings where people have prolonged and close contact with infected individuals, such as healthcare facilities or households. Preventive measures such as avoiding contact with wild animals, practicing good hand hygiene, wearing personal protective equipment when handling animals, and promoting quarantine and isolation of infected individuals can help reduce the risk of transmission of monkeypox. If you suspect you have been exposed to the virus or are experiencing symptoms of monkeypox, it is important to seek medical attention for proper diagnosis and management. Can you provide more details about how long the monkeypox virus can survive on surfaces? The exact duration that the monkeypox virus can survive on surfaces is not well defined and can vary depending on environmental conditions such as temperature, humidity, and the type of surface. However, like other enveloped viruses, monkeypox virus is known to have limited stability outside of the host and is susceptible to inactivation by environmental factors. Studies on related orthopoxviruses, such as variola virus, the virus that causes smallpox, and vaccinia virus, have suggested that these viruses can remain viable on surfaces for several hours to a few days under optimal conditions. For example, research has shown that orthopoxviruses can survive on surfaces such as metal, plastic, and glass for up to 24 to 48 hours under laboratory conditions. It is important to note that direct contact with infected animals, their body fluids, or contaminated materials is the primary mode of transmission for monkeypox. While the risk of transmission from contaminated surfaces is low, practicing good hygiene, regular cleaning and disinfection of surfaces, and proper handwashing can help reduce the potential for infection. If you suspect that a surface may be contaminated with monkeypox virus or any other infectious agent, it is advisable to clean and disinfect the surface using appropriate disinfectants and follow recommended hygiene practices to prevent the spread of the virus. Is there a specific disinfectant that is recommended for cleaning surfaces potentially contaminated with monkeypox virus? There is currently no specific disinfectant that is recommended solely for cleaning surfaces potentially contaminated with monkeypox virus. However, the Centers for Disease Control and Prevention, CDC, and other public health authorities recommend using EPA-approved disinfectants that are effective against enveloped viruses, as monkeypox virus belongs to the Orthopoxvirus family, which is an enveloped virus. Examples of EPA-approved disinfectants that are effective against enveloped viruses and may be suitable for use on surfaces potentially contaminated with monkeypox virus include 1. Bleach, sodium hypochlorite, a dilute solution of household bleach, containing 0.1% sodium hypochlorite, can be used to disinfect surfaces. Prepare a fresh bleach solution daily and follow the manufacturer's instructions for proper use and dilution. 2. Alcohol-based disinfectants, ethanol, ethyl alcohol, and isopropyl alcohol, isopropanol, are effective disinfectants against enveloped viruses. Use alcohol-based disinfectant wipes or solutions with at least 70% alcohol concentration. 3. Quaternary ammonium compounds. Some quaternary ammonium compounds, such as benzalkonium chloride, are effective against enveloped viruses and can be used as disinfectants for surfaces. When using disinfectants, it is essential to follow the manufacturer's instructions for proper dilution, contact time, and application method to ensure effective disinfection. It is also recommended to wear gloves and other personal protective equipment while cleaning potentially contaminated surfaces. If there is a known or suspected exposure to monkeypox virus, it is advisable to consult with public health authorities or healthcare professionals for specific guidance on disinfection protocols and recommended disinfectants for the situation. That wraps up our discussion on monkeypox. I hope you found this video informative and helpful in understanding the virus, its symptoms, treatment options, and prevention strategies. If you have any questions or personal experiences to share, please leave a comment below. Don't forget to like this video and subscribe to my channel for more health-related content. Thanks for watching, and stay safe.